All right, we are live. Good evening, everyone, and I hope you're doing well this evening. If you've just tuned in and this is the first time that you listened to any of my talks or watched any of my videos, my name is Cindy Bartz. I'm a certified yoga instructor as well as in Tai Chi and Qigong and food healing, and my specialty is osteoporosis. I don't have anything to sell you tonight. I'm just giving you some information about osteoporosis. And tonight, whether you have osteoporosis or not, we are talking, or I'm talking about being vegan and vegetarian and if it's a good idea. So let's get started. And at the end of this, if you've got any questions, just go ahead and chat. You can open a chat window and chat. If you're listening and watching this after the live, you can certainly post a question and I'll get back to you as soon as I can. So without further ado, let's talk about vegan and vegetarian lifestyles. So first of all, let's define them because there seems to be so many different types of diets out there and different things that people eliminate that sometimes there's a little bit of a blurring of lines. So vegan basically means a person that does not eat any food derived from animals. So that's including dairy, not just from cow, but goat or any other type of animal. So dairy, eggs, and even honey. So if you're a purist when you're vegan, even honey, because it comes from bees, again, is food that's derived from another being. So you wouldn't eat any of those types of things. Where a vegetarian isn't quite as strict and doesn't eliminate quite as many foods. Basically, vegetarian means a person who does not eat meat. And I know some people, the definition of meat means beef and pork. But in this case, we mean, some people say, I don't eat anything with a head. So a little joke there. But chicken, fish, seafood, beef, pork, all your different kinds of meats or animal proteins is what I would call them. But many vegetarians still eat dairy products and they also eat eggs. So, with that, a question for you. Are these diets healthy? And can you get all of the nutrients that your body needs when you're vegan or vegetarian? And unfortunately, the short answer to that question is no. In most cases, you will need probably to supplement or incorporate a few supplements in your daily diet because you won't be able to get those nutrients from a vegan or vegetarian diet. So why go vegan or vegetarian? For most people, I think when you ask them that question, why did you go vegan or why did you go vegetarian? Probably for the most part, people will say that it was to eat healthier. Meat is more difficult to digest, and some people, especially beef and pork, may have a problem with that. So, from a digestive issue, problems can be pretty huge, it can be a contributing factor to your overall health. So, that's one of the reasons why somebody might go vegan or vegetarian is for a healthier life, and they feel eliminating these foods is going to help them in their digestion and maybe some other things that they are having problems with. The other thing is that we can't forget that there are some folks that they go vegan or vegetarian for ethical or moral issues and concerns. So for instance, I'm a yogi, and if you know anything about yoga, there's a text called the Yoga Sutras, and part of that is the 8 limbs. And the 8 limbs there's the yamas and the niyamas. And in the yamas, one of the yamas, the principles and aspects of that is nonviolence. And so as a yogi, sometimes people might take that to, mean nonviolence of violence of any being, whether it's an animal or any type of other thing like that. So like I said, for some, there's the ethical or moral issue that comes into play with vegan or vegetarianism, religions, belief systems. So the next thing I want to talk about is protein. That's the thing that seems to come up the most. Like if you say to someone, I'm vegetarian or I'm vegan, they're like, oh, how do you get your protein? Seems to be like the most common question out there. Most people, when considering going vegan or vegetarian, a lot of people think that protein is the issue. And actually, in reality, this usually is not the issue. There's very few people, especially in the United States, but in any civilized, not third world countries, but other countries, that are more economically secure, so to speak. Protein is really not an issue. We don't hear much of a protein deficiency in people, right? Protein is literally found in all foods. A cup of strawberries has about 1 gram of protein in it. So fruits, vegetables, grains, legumes, nuts, seeds, everything has protein. Now, of course, there are some foods that have a higher content of protein than others. But the other question that sometimes comes up is, how much protein do I really need on a daily basis? Most sources, if you Google and just do a little bit of research on this, most sources will tell you it's about 1/3 of your body weight. So a good calculation, if a person weighs 100 pounds, which most people weigh more than 100, but you just take that as an example. A person that weighs 100 pounds needs about 30 grams of protein a day. That's not that much. 3 ounces of salmon is 20 grams, right? And when we get into like beans, legumes, grains, that sort of thing, I think a half a cup of most of your beans, like black beans or pinto beans, I think a half a cup is around, I would say 5, maybe as many as 8 grams. So really, for the average woman, probably that weighs 120 to 130 pounds or so, we're talking about 40 grams of protein a day. So it really is not the most concerning factor when you go into becoming vegan or vegetarian. And don't forget too, and I've talked about this in some of my other discussions, is that too much protein can also cause health issues, such as kidney and liver disease, as well as some digestion concerns. So too much protein is not a good thing either. So as far as vegetarian and vegan is concerned, it's really not the protein that's so much a concern. There are a few other concerns, though, that I want to bring up. And one is B12 and B vitamins in general. Keep in mind, B12 and the other B vitamins are very difficult to get in a vegan and vegetarian diet. For instance, foods that are high in B vitamins include beef, liver, seafood, poultry, eggs, and dairy, right? Those are some of the foods that are highest in the B vitamins. Signs that you may be deficient include weakness or a tiredness, lightheadedness is in there, heart palpitations, shortness of breath, pale skin, and loss of vision. So those are some of the symptoms if you're deficient in B vitamins, and especially B12. We probably have all heard of people, and maybe even yourself, that have been deficient in B12, and usually you're very tired and weak and lightheaded, that sort of thing. The thing to keep in mind with these deficiencies or the symptoms of these deficiencies is the fact that a lot of common health concerns have those, right? Weakness, tired, lightheadedness, shortness of breath. Those are very common symptoms of many health concerns. So just because you have those symptoms doesn't necessarily mean that you're, deficient in B vitamins or B12. What I would suggest is that if you've got any of those symptoms, to obviously talk to your doctor, and he or she can run some blood tests to determine if it's a B vitamin deficiency. I usually suggest folks who do not wish to eat meat take a B complex supplement. So instead of separating out B12 from all the other B vitamins, to just take a B complex, because there are several B vitamins, and I feel it's important to have the total package instead of just getting one of several B vitamins. So the other thing, and I've said this before, I do not believe in overloading. And it's really, really easy when it comes to B vitamins to go out there and look for over-the-counter supplements for B vitamins and finding huge, huge amounts. And I would not recommend or suggest that. I suggest, finding one that maybe is 100%, maybe even less than 100%. And also, I think it's important, if you're going to take a B complex, there are some out there that are time released so that you don't get like a whole big surge of it at one time, but it's time released over maybe 8 hours or 12 hours or maybe even 24 hours. I think that's a better way of supplementing your B vitamins, because especially with B12, you will have usually a surge of energy. It's best if you take your B12 or B vitamin complex in the morning or early afternoon, because it will give you more energy. So taking it later on in the day may not work so well for you, especially if you've got some sleeping concerns. So the B vitamins are a concern with a vegan or vegetarian diet. The other concern has to do with iron. And yes, plants do have iron. However, there are two different types of iron. There's heme and non-heme, H-E-M-E. So heme and non-heme. Iron found in meat is about 40% heme iron and 60% non-heme iron. Whereas the iron that you get from plants is 100% non-heme. So what does that mean? So studies have shown that non-heme iron is not as readily absorbed as heme iron in your body. And as a result, sometimes if you're vegan or vegetarian, even though you may feel like you're eating a lot of foods that are high in iron, they're non-heme iron. And it still may cause an iron deficiency. More than 95% of the functional iron in the human body is in the form of heme. So just keep that in mind. Again, let's look at the symptoms of an iron deficiency. And this is going to sound really familiar. Weakness, tiredness, lightheadedness, fast heart rate, heart palpitations, shortness of breath, pale skin. You might notice that these are all the symptoms that I said that were the same as the B vitamin deficiency. Also, for iron deficiency, a lot of times you may have the feeling of being really, really cold, like cold all the time. You can't warm yourself up. You also, if you've had iron deficiency for quite some time, if you look at your nails will actually have like little ridges on them, and a lot of times your nails are brittle. So that's some of the symptoms of iron deficiency. Here's why I'm bringing all of this up and why it matters when it comes to osteoporosis and osteopenia. There is a direct correlation between iron deficiency, anemia, and osteoporosis. So I found actually 3 different medical studies regarding iron deficiency and its connection to osteoporosis. So first study was done in Turkey. There was 371 post-menopausal women. They participated in this study. 82 of the 371, 82 of them had anemia. And basically, bottom line is this: the research team found that the women with anemia had significantly lower T-scores in their femur as well as their spine. Now, that's a small study. There was only 371 women and only 82 that had anemia. There was another study. This one was done in Taiwan, and it was actually, there was about 1 million people that were part of this study. And the study was between 1998 and 2012. So it was a fairly long time span as well. And the study concluded that osteoporosis occurred more often among iron deficiency anemia patients compared to those without anemia or an iron deficiency. Also, the risk of osteoporosis was reduced for patients with an iron deficiency or anemia who received treatment. So in other words, they were given some sort of iron supplement or in some cases blood transfusions. And by doing that, the reduction, believe it or not, the reduction was 95% of the patients improved. So again, a direct correlation between iron deficiency, anemia, and osteoporosis. The third study, which was done in 2015, and they basically, the research team concluded the same thing. Based on current knowledge, they said we hypothesize that iron deficiency with or without anemia negatively affects bone health. So here's the bottom line. I know that for most of you, you want to eat healthy. You want optimal health. And there's a lot of talk. There's quite a few of these documentaries out there that going 100% plant-based diets, and they have all of these statistics. I will tell you that for some people, vegan or vegetarian lifestyle is really not the best idea, and it actually will lower your overall health instead of improving it. So for some, it's probably because you are interested again in eating foods that contribute to your overall health, and that's why you're looking for this. But also remember that one size doesn't fit all. This works really well. Vegan and vegetarian works very well for some people, and for other people, it really does not. I think some of this actually has, and this is my own theory, I've never read or seen this anywhere, but I really think that some of this has to do with your culture and your DNA. You know, for instance, I actually was vegan, strict vegan for a couple of years. And during that time, I not only was diagnosed with osteopenia, but the other thing is I was diagnosed with anemia at the same time. And when I went to a naturopathic doctor, she basically said, your body isn't, because she looked at my diet, she's like, you are eating so healthy and you should be getting iron, but my body wasn't absorbing it. Now, one of the things is I'm European, I'm German, I'm Polish. That's my heritage. And let's face it, those cultures, if you've ever been over to Germany and Poland, they eat a lot of meat. So I think part of it is my DNA, and it might be the same for you. Whereas someone that's maybe more Middle Eastern or Eastern Indian, because their DNA is different and they've, through the generations, they have not eaten that much meat, it might work better for them. So again, one size doesn't fit all. Usually my suggestion has always been, and will probably always be, and I've said this before, if you're really looking for optimal health, I really, really strongly suggest the 80-20 rule. And again, what is the 80-20 rule? 80% of your plate is plant-based foods, and about 20%, 15 to 20%, is animal-based. So your fresh fruits, vegetables, grains, legumes, and other non-processed foods are always healthy choices. The animal protein will not only give you the necessary protein that you need, but also it's going to supply you with things like iron and B12 and other B vitamins and some other nutrients that are very much needed for bone health. And then the other thing that I just want to say is if you're feeling tired, you can't seem to warm up, you're cold all the time, out of breath, muscle and joint pain is something else that sometimes comes up. These are all the symptoms of iron and B12 deficiency, and basically a simple blood test is going to determine if you need a supplement or not. So if you do decide to go vegan or vegetarian, I would strongly suggest that you let your doctor know that, and like at least once a year you get some blood tests to just make sure that you're not deficient in some of these really necessary nutrients, especially when it comes to bone health. So that's it for my talk tonight. It's about 20 minutes. And any questions? I always take questions at the end. So any questions here? Not seeing any questions pop up. So if you're not live and you're watching this, thank you for watching. And again, if you've got any questions, just put them in the post. Just post them down below, and I usually answer them within a couple of days. And also, if you have not subscribed to my channel, please, please, please subscribe to my channel. That way, you're not going to miss any of my future videos, and you'll be notified when I do my live sessions as well. So take care. Next week, oh, I almost forgot. So next week, I always tease you a little bit with what I'm going to talk about next week. Next week, I'm going to start talking about myths, M-Y-T-H-S. Sometimes don't pronounce that quite right. Myths, and how the myths that go along with osteoporosis and osteopenia. So I'm going to start talking about those next week. So I hope to see you soon. Thank you so much for watching, and take care.